that diet plays a major role in our lives. One should always consume what we call a balanced diet. We also know for the fact that poor diet quality is a key factor associated with various diseases, even including obesity and various other chronic diseases. So understanding the associations of what factors, majorly if I talk about the socioeconomic and geographic factors that influence the diet quality, and in turn this can inform the public health professionals and policy efforts that can be made for advancing the health equity. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about a very interesting study that focuses on the association of socioeconomic and geographic factors with diet quality. For decades, numerous health organizations have published guidelines on healthy diet and lifestyle for the prevention of diseases such as even cancer and various other chronic diseases. Now, a body of evidence suggests that greater dietary and behavioral concordance with these guidelines is associated with a significantly lower mortality rate from cancer, cardiovascular diseases, and even various other causes. Now, all these including among people from historically marginalized racial and ethnic groups, as well as individuals with limited resources. Now, for the same reason, a recent study published in the JAMA Network Open pointed out a question. Are social, economic, and geographic factors independently associated with diet quality? The study that I'm talking about included a cross-sectional analysis of over 1.5 lakh adult participants who all completed a very validated food questionnaire, after which the data was then analyzed. Now, poor diet quality was defined as the lowest quartile of dietary concordance with the 2020 American Cancer Society recommendations for cancer prevention score based on sex-specific intake categories of vegetables and legumes, whole fruits, whole grains, red and processed meat, highly processed food and refined grains, and even the sugar-sweetened beverages. The results of the study showed that among the total participants, 79.3% were women, while among the others were the American Indians or the Alaskan Native individuals, Asians, Native Hawaiian or Pacific Islander individuals, Black, Hispanic, and even white individuals. It was then found that when compared with the white participants, Black participants had a 16% higher risk of poor diet quality, while the Hispanic or the Latino had 16% lower risk, and Asian, Native Hawaiian, and Pacific Islander participants had a 33% lower risk of poor diet quality. After controlling for other characteristics, the rural residence was associated with a higher risk of poor diet quality, and living in a food desert was associated with a 17% higher risk. Associations of income with diet quality and education with diet quality, it varied by race and ethnicity. Hence, the authors concluded that multiple individual level socioeconomic and geographic variables were independently associated with poor diet quality. So the authors sent out a message saying that these factors could be targeted for improved messaging, behavioral intervention programs, various other types of programs and policies for everyone to have an equal opportunity to eat a balanced and a healthy diet. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.